power and politics are shaking the very core of America's public health, right when millions depend on stability most. In a stunning new twist, the White House has named Jim O'Neill, a top aide to Robert F. Kennedy Jr., as interim head of the Centers for Disease Control and Prevention, CDC. This abrupt appointment comes at the climax of a messy showdown, as outgoing CDC Director Dr. Susan Monarez, just confirmed last month, refuses to step down quietly. And her legal team insists only President Trump himself can lawfully dismiss her. But here's where it gets controversial. Is this a bold new direction or dangerous political interference in the very agency that protects our nation's health? Let's break down what led to this explosive situation. According to a White House official, Jim O'Neill, now Deputy Secretary at Health and Human Services, HHS, will temporarily assume control at CDC. Some see this as giving Kennedy, who's championed significant changes to national vaccine policy, a trusted partner to help advance his agenda. Unlike Monarez, who is a recognized infectious disease expert, O'Neill does not have a formal background in medicine or science. Instead, his past roles range from speechwriter at HHS under George W. Bush to close work with influential tech investor Peter Thiel, who is well known for his conservative stances. And this is the part most people miss. The internal ripples have turned into waves. The firing of Monarez has triggered resignations among 4 senior CDC leaders, citing what they describe as dangerous political meddling, steep funding cuts, and the growing spread of health misinformation under Trump's administration. The sudden replacement has sent shockwaves through the scientific community, raising fierce questions about how public health decisions are really being made behind closed doors. Despite being fired via HHS on Wednesday with no clear reasoning provided, Dr. Monarez is not accepting her termination. Her lawyer, Mark Zaid, boldly insists that as a Senate-confirmed appointee, only President Trump can remove her. On social media platforms, Zaid declared that Monarez's firing was legally insufficient and asserted she still holds her CDC post, informing White House counsel of their challenge. Will the courts need to step in? Meanwhile, President Trump's spokesperson, Kush Desai, responded with a pointed statement. Susan Monarez is not aligned with the president's agenda of making America healthy again. According to Desai, the White House removed her after she declined to resign, despite indicating otherwise to HHS leadership. What's driving the conflict? Internal documents and statements suggest Monarez's refusal to implement orders that conflicted with scientific consensus, especially regarding vaccines and the removal of expert voices from the agency. Kennedy, now in charge of CDC, has a history of championing anti-vaccine narratives and recently restricted COVID vaccine use for Americans, cut research funds, and dismissed expert advisors. These actions, Monarez's legal team argues, are part of a dangerous campaign to reshape the CDC for political gains at the cost of public safety. First it was independent expert committees, then it was the purge of experienced scientists. Now it's the targeting of Dr. Monarez herself. Monarez's attorneys warned, inviting public scrutiny. The tensions extend far beyond vaccines. Monarez and Kennedy reportedly clashed over vaccine policies, and CDC staff expressed outrage at the administration's response to a tragic shooting at CDC's Atlanta headquarters, in which a security officer was killed earlier this month. 4 senior CDC leaders who resigned, Dr. Deborah Howery, Dr. Daniel Jernigan, Dr. Jennifer Layden, and Dr. Demetri Daskalakis, were each responsible for critical domains ranging from medical officer oversight to public health data. Dr. Jernigan, who managed vaccine safety, revealed in interviews with Reuters and The Washington Post that his breaking point was being pressured to revisit and alter studies about vaccines and autism, even as this link has been thoroughly disproved. He alleges Kennedy's advisors asked him to edit vaccine safety research to align with anti-vaccine views. Can you imagine being pushed to change scientific facts for political reasons? The uproar has also reached Congress. Senator Bernie Sanders called Monarez's attempted ouster outrageous and demanded a public hearing, stating bluntly, "Vaccines save lives, period. Senator Elizabeth Warren, meanwhile, highlighted that O'Neill praised Kennedy for his handling of a Texas measles outbreak during his confirmation hearing. Despite the outbreak being one of the largest on record, Warren didn't mince words. These fools can't be trusted with your health. Is replacing scientists with loyalists with little health expertise what America needs right now? As for O'Neill, his resume features everything from launching the Teal Fellowship, which pays young people to skip college, to openly criticizing the CDC's COVID-19 response. Still, when Kennedy backed him for deputy secretary, he cited O'Neill's Silicon Valley ties, never any record in healthcare or science. Is that enough experience to lead a premier public health agency? All of this leaves us at a critical crossroads. Is the shakeup at CDC about reform or control? Should leaders with no scientific training oversee America's top disease-fighting agency? Or are we witnessing a dangerous politicization of public health that may put lives at risk? Now, it's your turn. Does this fundamental change in CDC leadership make you hopeful for real reform? Or does it worry you about the future of science in policymaking? Are these bold moves long overdue, or are they undermining the very foundations of public health in America? Leave a comment below to share where you stand on this growing debate.